Hello and welcome to Rive Reflections in Veterinary Education. This episode, I'm going to turn it over to Catherine, and who can introduce our special guest for this show.
Thanks, Bobby. I'm excited to welcome Dr. Micha Simmons to the show tonight. She is a soft tissue surgeon and a professor, and I'm going to kind of throw it to you to tell us just a little bit about yourself and how you landed where you are.
Yeah. So thanks for having me, first of all. I am an alum of the University of Pennsylvania, so I was a class of 2008. Sounds really long time ago at this point. And then I completed various postgraduate training, including a small animal surgery residency in private practice in 2014. As you mentioned, I do dabble in surgery and practice limited to small animal surgery with a focus on soft tissue. So my academic career really started at Purdue University, and I took a clinical instructorship right out of my residency. And I stayed there for about 3.5 years as an assistant clinical professor of small animal soft tissue surgery. So, I don't know. From there, I kind of decided that I wanted to be an academician. I was in it. But I also realized how much I didn't know in the educational space. And so I left that position to pursue an educational fellowship at Lincoln Memorial University, which is where you and I crossed paths, Catherine.
Yes.
And I stayed on for a couple years there. After finishing the fellowship as an associate professor of veterinary medicine and surgery within CIVET, which is their educational group, and completed a master's of veterinary education there in 2022. So
Yeah. So tell us a little bit more about that because you were actually one of the first you were like one of two of the first people to graduate from the Master of Veterinary Education program. So tell us a little bit about why you decided to pursue that and what you feel like that did to enhance your experience or I guess, your position where you currently are.
yeah, so like I said, when I was at Purdue, I really decided I loved education. I loved teaching both in the classroom and especially in the clinical setting. I really, really loved the connection with the students. Um, but I kind of felt like I mean, this is where the imposter syndrome flares up, right? Like I felt like, what business do I have teaching anybody when I haven't really focused on the discipline of teaching? Like I did all the surgical stuff, but then how do I make sure that how I'm teaching somebody else surgical things is correct or founded in any kind of evidence? And so that kind of led me down the path of exploring like what options there were for veterinary educators. And at that point, there was really only the one, the various certificates overseas. So um, that was something I started to delve into. But at the time commitment and sort of fitting, even though it's asynchronous, but trying to fit that in on a clinical instructor or clinical professor's load already was virtually impossible. Um, and so that's what kind of led me to look into other avenues. And eventually I found the fellowship. And even though it wasn't a master's per se, we kind of talked about how I could carve out the space to complete a master's, not really knowing that they were intending to have their own master. So it kind of worked out.
Yeah. Very
Can
cool.
you, Mike, I think the fellowship is a really unique thing that is just not, it doesn't exist elsewhere. So I would love it if you could just tell me a little bit more about like what that meant. Like, yeah, what was your fellowship, and and how much, if you know, like what went into developing that, and what it was like for you.
Yeah. So, and Catherine, correct me if I'm wrong, but I think at the time I was like the second or third fellow. And so it was a very unique position in that I think what I wanted to do was very different from what others had done. And also the fact that I was already sort of teaching. So I wasn't like fresh out of my residency or fresh out of vet school. And so my position kind of became a hybrid, which in itself was fun because I didn't lose the connection with students and the teaching, but I got to sort of dabble in some creating faculty initiatives and starting to really delve into what it meant to focus on education as a veterinarian because there just wasn't very much out there. And so Catherine and I under CIVET, so the Center of Innovation in Veterinary Education and Technology, our charge was also to sort of start making sure that as best we could, there was some research-based foundation to the curriculum and to initiatives that came out of CIVET and spread to LMU Vet School as a whole. And so that was a lot of fun for me because it really got me into the theory and, exploring what really is Bloom's taxonomy and, all of the things that we kind of take for granted and we throw around as like, oh yeah, just follow Bloom's. What's Bloom's? So yeah.
I have a question because you mentioned that you felt a little bit like an imposter because you were supposed to be teaching people, but you didn't really know or felt like you understood enough about education. And this is something that the three of us talk about quite a bit on this, is this idea that a lot of veterinary educators really don't care about that. They're just sort of like, I'm a great veterinarian, I can teach, right? I have all this training and all this knowledge, I can teach. So, and maybe you can't answer this, but is there something that sort of clicked in you that was like, wait a minute, education is a discipline, I really need to learn more about that? Or can you just kind of tell us a little bit about your thought process and what got you to believe that you needed more training in the education space?
Uh yeah, I think some of that is just intrinsic to who I am. Like I've always like if there's something else that can be done to make me better at what I'm supposed to be doing, that's kind of what I choose to do. I also think in teaching, or in my teaching experiences up to that point, I wondered how to make things better for the students that struggled. So there's always the students that no matter how you teach or what material you give them, they're going to make it through. But then what do you do with the ones that don't? And how do I make sure that I have enough tools to help them to the best of my ability? Like, how do I make sure that their challenges aren't because of me?
Mm.
And so I think that was also a huge driving factor, was just making sure that I was doing right by the students.
So do you feel like learning sort of the foundational theories and philosophies of education helped you in that regard, or do you feel like it really wasn't that helpful?
I think it was helpful in the sense that now I know why things happen, right? So I don't know that it really changed a lot of what I do for the day to day, but I definitely have a better understanding of why those things work. And on the same token, for the students that it doesn't work for, I can pull from other now areas of knowledge and try something different that maybe is not something that I naturally lean towards in my educational endeavors, but I know that, hey, maybe this approach would work for this particular student.
Yeah. I think that's interesting because that's, I think, what most of us have said as well, right? It didn't necessarily change what we did or how we did it, but it helped us understand why what we did worked or why what we did didn't work. So,
Yeah.
Eric, it looked like you had a question.
Yeah, was there anything growing up that made you incline towards teaching? Like where along your life were you like, yeah, this sounds like the way I want to spend the rest of my days?
Um, I don't know that there was one pivotal moment. I think I've naturally just sort of leaned that way. So, I was involved with like kids camps for the zoo and like an ecologic society in Bermuda where I grew up. Um, my thought process also was that if I didn't get into vet school, perhaps I should be a teacher or, so it was always kind of there. Yeah, I'm not sure. I'm not really sure why, but
It's funny because I feel like I was like, no, I'm not going to teach. Teaching's not what I want to do. And, absolutely not. And it wasn't until after like I went on like for additional training and was like, oh, I actually kind of like this teaching part. Like there's parts of this that can be really fulfilling. And then it took me a while because again, you mostly just model what other people have done. And it was like, oh, there's this whole body of knowledge out here. Of course there is, right? And you feel kind of like it was kind of dumb. Like, why didn't I realize that before? But it is funny how like different paths, but ultimately what you said that really resonated, Micah, was like, how can I do better for my students, right? And particularly the ones that they're putting the effort in, they're doing the things, and they're still like struggling. Like, okay, am I part of the problem because I'm not doing everything I could be doing? Again, the students that like they're excelling, they're going to be fine. Like, yeah, and good for them. I want to support them too, but I feel like it's that 10% that you can change things. You're like, that's where I'm missing, and I want to be better. So I think that's what really resonated. No matter how we got to that point, I think that's a big motivator for all of us. Is we have these people who are working really hard. They're smart. They've demonstrated time and time again they can do this, but like this is also a lot that we're asking of them, and how can I support them a little bit better? And yeah, it's I think the other thing is you kind of talked about, it's not like learning the theory is going to be like, oh, it's going to revolutionize everything and change everything about your teaching, but you do make changes, right? And sometimes they're gradual changes, but I think they're now research informed changes, right? It's not like this study says teach this way, but the theory is like, this is a more likely option to work than this other one. And so I think we can be more efficient with how we're making adjustments to our teaching, which is, I think, really helpful.
yeah, it's sort of, I don't know, it's kind of hypocritical, right? Like we tell our students like, you want it to make evidence-based decisions, and where's the research, and that was like a whole arm of our lives that we just like, nope, doesn't exist. I'm just gonna do it this way.
Yeah.
I think in thinking about it also, I know the struggles or the places where I had challenges as a student, and thinking back, if somebody like, could that have been different if there was a bigger focus on education at the time as well, was also part of it, knowing that like vet school wasn't easy for me. And talking to me in vet school, I definitely didn't think I would end up as an educator. Like I wanted to go back to Bermuda, I wanted to be a GP, like shots and puppies, and it was all going to be great. And life has a funny way of changing things.
Yeah.
You know
I
what?
think
I have always assumed that the things I struggled with in vet school were because of me.
Mhm.
And I graduated 25 years ago, and I've never had that original thought before now.
You
That
just
like,
now thought like,
oh,
what if
Oh,
it wasn't?
really?
maybe it was
Wow.
the delivery that
Oh,
was,
I've had that thought multiple
huh.
times.
Eric, I love that you're having this epiphany now that all
Yeah.
this time you were like, no, that was all me. And
It's
suddenly,
just
after all these years as an
I'm
educator,
just not good at blood gases. I better do an anesthesia residency, you know?
Well, I mean, Eric, it makes sense, right? Like 85, like there's so many other students in the class who are doing well. So it's like, oh, it's got to be me. But then at the same time, it's like, well, maybe if I had just, now there's so many like different, like multiple modes of presenting stuff. And it's like, oh, if I had had that song back then, I
Right.
definitely would have remembered this. So
I also love that you're having this because you have an education degree and you still haven't had this epiphany until just now, which I think is really fascinating, right? And I think it really speaks to a level of imposter syndrome or self sort of flagellation that a lot of us go through. And I'm I'm happy to say that I have not self-flagellated about that because I knew that some of the reasons that, not all of them, but a lot of the reasons that I struggled in vet school were because of the delivery and because of the way I was tested. Um, so I don't know if I told you all the story about my radiology, like my harrowing radiology experience. But when I look back on that, I'm like, well, yeah, this dude had absolutely no idea how to teach. He literally was convinced that memorization was the way that you learned. And then if you look at the exams, like it was 10 or 15 seconds of this extremely blown up plain film radiograph that we had to look at in a dark room. And then the questions were like A through E were the option, or A through J, actually. One of them was A through J were the options. And it was like Roman numeral 1, A and B only, Roman numeral 2. And it literally went through like
Yeah, it's a
Roman
logic
number
problem.
1 through number 10. And I'm like, well, how the hell am I supposed to demonstrate that I know anything when you're asking me these types of questions? So yeah, I think those are the kinds of things that I think help us as educators help our students understand, right? Like,
Yeah.
because we're going
And
in
I think,
trying to do our best and our students are looking at us like you're crazy. But if you can say, listen, I tried this, obviously it didn't work, but this is why I tried it, and maybe I should do it slightly different. I think that makes a huge difference.
yeah. And I think I also questioned some of that clinical year, because that year, like, I really did excel. Like, and the challenges that I had, like, disappeared. And so it was like, okay, so what is so different now? And it's like, it's the experience. Obviously, like, I tell students this now too, but like, you catalog and you put it all together. So you've changed as well, but it was just a different way for me to express the knowledge that I actually did have, despite maybe not necessarily being able to pull it out on the A through Z test that they gave us.
I had a very similar experience.
I think the other thing that I find fascinating, and I think draws into like Eric's epiphany just now, is I had to learn how to learn, right?
Mhm.
Like in vet school, the volume of material was suddenly so different, and it's all cumulative, right? Like it's not just like learn it for the test and then forget it. Like it's building and building. And I realize now, like honestly, first year of vet school, there should be a class on how to learn, how to study, right?
100%.
Like, why are we thinking that people are just going to eventually stumble across it? And so
And
I
I
try to
think
make that really explicit now. But I had to learn that. Like, and sometimes like it was after this, like one of those anatomy tests, and you're like, okay, the old ways of studying are not working. What am I going to do differently? And so there was still some trial and error, because again, nobody taught us how to study. And you just blame yourself. You're like, I'm doing this wrong, right? So similar to like what you're saying, Eric. And that's so unfair too. Like, why don't you know how to learn? Well, wait, what? Like, because no one's ever taught me. Like, we don't talk about metacognition in
Yeah.
undergrad or high school or whatever. And so why are we surprised when people are like, whoa, this is a wake up call? We just need to be more explicit about it. And it is funny because yeah, I also blame myself. I'm like, wow, I didn't do a good job of preparing for this exam. And while there's maybe some truth to that, but also, how am I supposed to, I have to invent how to do this myself? Like,
Right.
that's
Yeah.
silly.
And so that was also like a frustrating thing is, I mean, and this, so exposing my dirty little secrets, but I was truly a lousy student. And it was like, I didn't study. Like, I didn't have, like, I hate to say it, but I never had to, right? So, like, elementary through high school, soared through, doing your homework in the car, whatever, like, it's fine. College, kind of okay, maybe I actually have to spend a night doing it, but nothing was like super challenging. And then you get to vet school and you're like, what just hit me in the face? Like, this is awful. And so, you get your first couple of like lousy grades, and it's not I had oh my God, I suck at this, right? Like, but then when you go to somebody and you're like, okay, can you tell me how to be better at this? And you get, oh, you just have to put more time in. And it's like, I don't think it's purely a time issue. Like, I'm clearly missing like some fundamental something here. So
And
Yeah, I
it's
think
really hard because that is the feedback you give. And I gave that advice to students for a while, right? Like that was also me, like, all right, you're going to have to do these things and you're just going to have to put more. No, it turns out we need to be more efficient. We need to learn how to study effectively. But it's really unfair to expect students to just suddenly like, intuit how it is you're supposed to study. It takes us decades, and some people never figure it out if you don't teach them. And it's and it feels really bad because I was the same way. I think we all were like, I think most people who get into vet school didn't struggle as much early on, right? Like that's kind of who we're selecting for, rightly or wrongly, right? Like that's kind of who we're selecting for. And then it's a big old wake up call, and you're just like, oh, okay. And then we're smart people, so we kind of figure it out. But boy, it would be so much easier if we just taught people how to do this. And then if we did that, how many more like barriers would we remove for other people? Like, wouldn't that be amazing if we just taught everybody how to learn?
Yeah.
I wonder if the put the time thing in, because I was thinking about this, like you were describing, you got to clinics and everything, worked and you excelled. I'm like, yeah, I had a very similar experience. And I have always attributed that to putting the time in, right? Like I was the first one in the hospital. I stayed late. I took like everyone's on call shifts that wanted to give them to me. Like I was just always there. And so I've always assumed like, oh yeah, like I showed up, and that I really do believe that like showing up and being there contributes tremendously. But why couldn't you apply the same thing to like learning in a classroom setting, right? Like you just put the time in, and you should be learning as well. But the setting, at least for me, was so different that I couldn't apply that same principle. So I wonder if like, we all like excel in clinics, and the way you get good is you put the time in. And so when someone's struggling, it's like put the time in.
Yeah.
Yeah, that's
I
part of it, but I also think it's the way things are done in clinics, right? People are asking you questions, and so it's a lot of retrieval practice. It's a lot of active learning,
Mhm.
and I love that like we're having like this. I love that this conversation and Micah, that we are causing Eric to like question everything he's thought
Well,
about
I think too, it's
own
also,
learning.
yeah, it's about the engagement. And I think I may be the exception to the rule here, but I was not the person who put the time in during clinics, but I still did really well. And it wasn't because I wasn't doing what I was supposed to do. I was there when I was supposed to be there. I stayed late if I needed to. I tend to brag that I probably had one of the easiest clinical years ever. I just got lucky in many ways. I don't know what karma thing happened, but I just had really lucky things happen to me. Um, but what I attributed, I was 35 years old when I finished up vet school, and I'd had a whole career in the military, and I had a whole different sort of approach to things. And so I attributed that to like a level of maturity that enabled me to go in and handle things in a different way at some level than some of the kids who are like 23, 24, 25, 26. But now that we're having this conversation, I'm like, but that can't be all of it, right? I had to have done something differently than my classmates to be, because I remember having conversations with my classmates who helped me get through all the exams and the tests and the sort of classroom-based stuff. And I remember having a conversation with them at one point, and they were really good students. And I was like, man, clinicals are awesome. Like nobody gets less than an A in clinics. And they're like, that's not true. I'm like, no, I mean everybody, I mean you just show up and you do your thing. And they're like, no, I've gotten a lot of B's. And I'm like, yeah, but you don't really get less. And they're like, no, and I'm like, oh, I probably should keep my mouth shut, right? There's clearly
Yeah.
something different about what I'm doing than what they're doing. Um, so yeah, I think it's interesting that many of us have had a similar experience. But what is it? Like, what is it truly
Yeah.
that clicks?
Yeah, I don't know. For me, like, because I can't say that I don't think I did as much as Eric's describing. So I wasn't like taking extra shifts or anything. That was
Overachiever.
not. Um, but what I did, I wanted to show. By that time, I felt like I almost had something to prove
Mm,
because I knew that what I had done thus far was not representative of my knowledge, and that to me, that year felt like my final time to prove that like, hey, I can actually like I'm actually gonna be okay at this. And like if that failed, then I need to think about a career change. But it's like, but that like so I'm having these kinds of thoughts and being able to talk through things and show your faculty like what you do know. And then if there is some level of deficit there, talking through it and seeing it and putting it all together was like vastly different than sitting in a classroom being lectured to somebody not still really not understanding what piece you were missing. And so I think for me that was a big part of it. But yeah, Catherine, I totally agree. Like sitting in rounds or whatever, and you hear about, oh, you've got so and so for medicine, like that's going to be awful. Good luck with that. You know, you go through and you're like, this has been like the best 3 weeks of my life. Like,
Exactly.
I mean,
Yeah.
some of those rotations, I literally went to the bursar. I was like, I want to, or the registrar, I was like, I want to repeat that rotation. Like, that was awesome.
Yeah.
And so I feel like it's multifactorial. And I don't, I don't think there's just one piece, but I definitely think that there's a lot of classroom things that can be improved still in veterinary education. I think the clinics has always been our strong suit, or I'd like to think so. I think that most people tend to do a pretty good job at teaching others on clinics. But I think the classroom piece is a little bit more challenging. And I don't know, maybe that's not right. I think some people have their struggles in clinics too, but
Sure, but don't you think the assessment piece has a lot to do with it? Like, I know when I was in school, for me, like studying for exams, I knew even at the time, like a lot of this, I didn't have the words for it, but I'm like, these are facts. This is recall, right? And this is like, yeah, that's fine, but I don't really care about that. I want to understand how the kidney works, right? And so when I was preparing in class, like I was really focusing on those things and I wanted to really understand how that applied to my patients. That didn't always translate to a great grade on the exam, right? So for the recall fact-based questions, that wasn't always there. But by the time I got to clinics, and they didn't care about me naming, some receptor or, but like, why are you doing these things? That's what I had been really focusing on for the prior 2.5, 3 years. And so I was ready, and so it was the assessment piece when you're talking to us, like now when we're on the other side, right? And you're talking to a student, you get a sense like, are they understanding the concepts or are they regurgitating, details and facts? Regurgitating details and facts is great for a multiple choice exam, but isn't really going to help you into the same degree in clinics. And so I felt like when I was in school, there were people who like crushed the first few years and they were acing all the exams and then they got to clinics and some of them continued to excel, right? But some of them like dipped off quite a lot.
Yeah,
They were really good at memorizing the things, really good at recall, but maybe weren't putting it all together. And then there were people like me who kind of flip-flopped. I was like,
yeah,
like I did fine. And like, I wasn't in danger of failing at any point, but I wasn't acing everything by a long shot. And then I got to clinics and it was like, I'm acing this, right? This is going much better. But I had been already sort of focusing on that. And so for me, I think a lot of it is how we are assessing students in the classroom versus in the clinics. And I think that can explain, at least, again, not all of it, but some of the differences.
Yeah, I agree. I was thinking as Micah, as you were talking, is like the whole conversational piece of it, right? You don't do that in the classroom. There's somebody up there lecturing at you. Occasionally they're asking for your input or asking you a question, but they're not necessarily engaging you in the actual thought processes, which is what we're constantly telling our students we want them to do. And we've had this conversation before of like, we tell students, live in the gray. Medicine is gray. Not everything is black and white. You need to learn the processes, but we test you in black and white. When you get into the clinics, then you're finally in those gray areas, you're in those processes. And so the people who have put the time in previously to understand, to think through things and sort of figure out why they're doing what they're doing, even if it's wrong, but they can justify why they did it in a conversation. And then the clinician can say, I can see where your train of thought is going. This is where maybe you went wrong. Let's have a conversation about that. That's not something that you get in the assessment piece in a classroom or a laboratory. So I think that might be a big part of it. And just the different style of learning. I mean, it's very much an apprenticeship style versus a sitting and getting style. So Eric, it looked like you had unmuted for a minute. No.
No, I appreciate the ask though.
Oh.
I'm just mulling all of this. It's wild. Like I'm just having a lot of really interesting thoughts about this. And
Eric's mind has
so
been
I'm sitting
blown.
here. So it's like, okay, so if we all are reporting that we didn't like classroom as much as being on clinics, so do we need to get rid of classrooms for vet school? Like, like what how, how can we make this better,
I think there's something to be said for potentially getting rid of some classrooms. I mean, I do think there are some topics and subjects that you probably do need to just sort of brute force yourself through, right? Like I pick on anatomy a lot. There are some things in anatomy you just have to memorize. Now, do we have to memorize as much as they told us we needed to memorize? No, I don't think we did. But there are just some things like you need to memorize and really become facile in the language of anatomy so that you can help sort of build your Latin vocabulary as you move through. But yeah, I mean, I think there are ways that we could potentially get rid of classrooms that might be really useful and a lot more welcoming and encouraging to students. I don't know.
What do
Micah?
you think, Micah, as our guest?
Yeah.
How do we solve vet med
Solve the
education? Really?
problems.
How do we solve it? I don't know. I definitely think if we could try to truncate the classroom line, and so like, what does that look like? Like, do we identify the foundational things and have maybe the fall semester is, this is what you learn, and then you kind of go into the clinics to reinforce it, and then you do the same for second year and maybe even third year. At Penn, they had I'm assuming they still do it. I don't know how their curriculum has changed, but there was the potential for early entry in the third year. And so that doesn't necessarily work for everyone, but having the option is really nice. I didn't take advantage of it. I kind of look back and I'm like, gosh, I should have. Like, I was so terrified to take that step because my experience in the classroom had been so like, I was like, I just don't think I'm ready. Um, but I wonder if sort of dipping your toes into the clinical experience earlier um, could help with some of the classroom issues. And it doesn't have to be full on clinics. Like, you wonder if maybe we adopt more of like the case-based learning style or something along the way. So it's not all just sitting and lecturing. As much as we like to say, oh, we have very engaging lectures,
Yeah.
they never quite end up being as engaging as
Yeah.
you had hoped.
You know what's fascinating as I listen to you talk, Micah, and you're mentioning like the foundation, right? The preclinical foundation. We talk about this all the time, and it's occurring to me right now that who says the classroom is the foundation and the clinics is building upon that, right? Now, I think we kind of assume when you're on clinics, you're seeing actual real cases, and therefore you got to be ready. But it's like, well, we don't need to have them seeing cases by themselves or even doing any part of that. Like, they're not going to go in unsupervised. And I also like kind of, I think, related to that, this idea that when you're teaching on clinics, and I hear this from faculty routinely, they get frustrated when the students don't have this foundational, what they consider is foundational knowledge before. And it's like, oh, I'm having to teach them that on clinics. Like, that's this horrible thing. And it's like, so, so like maybe we need to like flip things around. Yes, you don't want it to be a waste of time. So I don't know, Michael, what your thoughts are, because again, you do both. Like,
Mm-hmm.
how
I mean,
much
I think ideally, yes, right? Like, we would just have them in the clinics with us all the time. But I think like we would take in already, so like our veterinary teaching hospitals, they're not the most efficient spaces. So we're gonna then take it and it's gonna become less efficient because it's gonna be a whole language that potentially those first year students need to learn. And so for me, that's like what I consider foundation is like, are we even speaking the same language? Like, when we're talking about, glomerular filtration, or if we're talking about a certain class of drugs, like, does that mean anything to you? Because if not, to stop and like then explain some of the basics there is going to take a really big chunk out of the day when we're supposed to be moving cases along or whatever the case may be. So that's why I think, I don't know, a little bit of classroom here, or even like as mini lectures that they have to listen to prior, just something that kind of gets the language to be
No,
the same.
I totally agree, because I mean, learning the first couple of years of school is learning a new language. Like,
Yeah.
I've had that. I tell this story where, like rounding on, with some first year students when I'm like a senior student, and I'm presenting an equine case. I was like, I'm not a worse person, right? But I'm presenting and I'm like, okay, blah, 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 it's azotemic. And one of those brave students raise their hands and they're like, what is azotemia? And I'm like, oh my gosh, you're right. Like, I didn't know what that meant either. And so there is a whole language in order to converse. But I'm wondering, like, how do we reimagine what the clinical setting can look like so that we make room for those kinds of conversations and we make time without sacrificing? I mean, I don't know. I'm just
Well,
positing that.
I'm thinking here because why can't you bring some of those clinical cases into the classroom, right? So, I mean, one of the things that I remember really, really clearly, I know nothing about neurology. I thought neurology was fascinating, but don't ask me to localize a lesion. Like, that's just not going to happen, right? But I actually did really well in neurology. And one of the things that I remember distinctly, and I will never forget, is when we were talking about cerebellar hypoplasia, right? And sort of the incoordination and the ataxia and all the things that came in. And I will forever remember that the cerebellum controls those things because they brought in a dog named Cerebella that was a cerebellar hypoplasia dog, and we watched her walk. And the conversation was like, listen, you're going to see a dog like this or a cat like this. Can they still have a decent quality of life? Absolutely. This dog is happy. She's playing. She struggles a little bit when she's trying to eat because she's got tremors and she's trying to get her food. But I will never forget that. And that's like it's not a whole case, but it's a very sort of small piece of a bigger, you know, conceptual thing that in my head, I have this visual reel running. And every time I see an animal, you know, if it looks at all like that, I'm like, oh, that's probably cerebellar hypoplasia. Now, at that time, would I have been able to tell you what causes that? No, because we hadn't quite had all of that information, but you can still make those connections later. And I think in some ways, when I talk to students now who are going into clinical years, I don't think they ever feel ready to go into clinical, right? So whether it's first year or fourth year, they just know they're all like, I'm terrified to go into clinics. And it takes them a rotation or two to figure out that it's terrifying, but it's doable. And then they get more comfortable and everything's fine. And then they pass the NAVLE and they think, you know, they know everything. But what I tell students when they go into clinics is, and they're like, oh, well, we have to be in clinics to be able to pass NAVLE. I'm like, no, 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 no. Clinics don't help you pass NAVLE in the way that you think they're going to help you pass NAVLE, right? What clinics do is they help you consolidate all that information and put it together in a way with a case to refer to that makes it clearer in your head, right? But if you don't have that foundational information, if you don't understand some of the basics, the way physiology works, the basics of, and I hated physiology. I mean, it's great. It's fascinating. I hated it. There was not much about that school I liked, in case you haven't figured this out yet. But you know, but there are foundational things like you need to understand what causes a metabolic acidosis, and you need to know what the difference between metabolic alkalosis and acidosis are and how you can tell those things. But that doesn't mean they have to know that to be ready before they go into clinics to get that experience, right? They can find ways to incorporate that into the classroom and lab.
Yeah.
It will help consolidate that information probably more quickly and more strongly, I think.
Yeah, definitely. I think, and that's why I mean, making that connection early on is very important. So I think right now they're very siloed. So we have the preclinical year and the clinical year, and so it's like making it gray, right? Like making it really messy and bringing in and nothing. Thus far, I feel like nothing's more engaging to students than to say, "I just saw this case this morning. Can you help me?" You know, like that is like they love it. They want to be in clinics. That's where they want to be. So yeah, bringing some clinics to them, and it also highlights like the why, right? And so it doesn't, they're not left there thinking, why do I need to know this? Like I'm never going to use this. You show them in real time, like why whatever you're talking about then and there is important. So they don't have to sit there like, oh, I'm never going to use this. Yeah, you are. Look at this case.
Yeah.
I like that. I like the blurring of the lines in both directions, right? Like we can bring more of the clinic into the classroom, but not be so afraid of like, it's okay to review some of these things that maybe could also be taught, but they can be reinforced. And, you know, maybe this got missed somewhere. I skipped that day. I blanked out, whatever, and I need to learn it again. Okay. It's not necessarily efficient, but like that's okay too.
Yeah. And I think we're really bad about that, right? Like I hear so many times like, oh, the students already got that. And I'm like, yeah, but have you talked to them? Because they're gonna tell me in 2 seconds that they never did an ortho exam.
This is the distinction between, oh, I taught them, not learned it.
Exactly.
Right. Yeah.
And so what difference does it make if you taught them if they don't know it or if they haven't like committed it to memory or tethered it as something important? it doesn't matter yet. And we shouldn't be afraid to like repeat things or review things for students. And I feel like people think that it's a waste of time. And I'm like, if it's important, it's never going to be a waste of time.
Yeah. And
Yeah.
also maybe we need to like, we shouldn't be surprised that somebody heard something once one day 3 years ago and they like, really, do you
Yeah.
remember everything you've ever
Yeah.
heard? Like, let's be
Yeah.
realistic here. We're throwing a
Yeah.
lot at them. They're not going to remember it all. And if it is like exactly like you said, Micah, if it's important, it bears repeating. It's worth revisiting, and in
Yeah.
a different way, so they can make new and deeper connections. Like that's just strengthening what is. If it is that important, yeah, let's talk about it again. That's great.
Mhm.
Yeah. So I have a card. I tend to try to get a cartoon or something funny for most of my presentations. And there's one that it's a very famous cartoon, but it's basically characters, but it's basically a kid talking to his friend saying, "Hey, I taught my dog how to whistle." And they're going out there and they're like, "Okay, well, why isn't your dog whistling?" He's like, "Well, I told you I taught him. I didn't tell you he learned." Right. And I think that sums things up really well. Number one. And then number two, Michael Senner, who's a good friend of Micah's and I's, ours as well. He's actually a large animal internal medicine resident at NC State right now, was a biology teacher, high school biology teacher before he went to vet school. And when we talked to him, he tells this story about how he had a mentor when he was teaching that totally flipped the switch in his brain about assessment and the purposes of assessment. And he's like, so I was getting really frustrated because I was testing my students and they weren't getting anything right. And I didn't understand how I could teach them better to get them to be able to perform in this test better. And this really wise, great mentor of mine looked at me and was like, "Michael, did you like mow your lawn when you were growing up?" And Michael's like, "Well, yeah, of course I did." And he's like, "Okay, well, the first time you mowed your lawn, was it perfect?" And he's like, "No." And he's like, "So what did you do?" He's like, "Well, I kept mowing the lawn until I got better." He's like, "Exactly. That's a test. Every time you go out to mow the lawn, it gets a little bit better. But if you're not allowed to continue doing it or to continue learning from the things that you made mistakes about, how are you supposed to get better?" And Michael, he said this switch flipped in his head. He was like, all this time, like I thought an assessment was supposed to be like, boom, I know it, move on. But no, that's not what it's supposed to be. I mean, ultimately, yes, that's what we
Step
want
in
to
the
see.
process, though.
But it's
Yeah.
a
And that's,
demonstration of growth, not necessarily a test of what you do or don't know.
yeah. And that's a misconception on both ends, right?
Yeah,
Like, I think the students have the expectation that they pass the test, therefore they know it, but then the next semester they forget it, which is fine. But it's like, that doesn't mean that you weren't taught appropriately. That does like, but that's part of it, right? And I joke with them. There are things that I still, it's not really a joke, but there are things that I still forget daily. Like there are things that I just don't commit to memory. And so it's okay to look those up, but you also have to know kind of what you don't know. It's that whole metacognition and kind of recognizing like what's important for me to actually keep in my mind and what's okay for me to realize I don't commit that to memory, and here's a textbook that I'm going to find it in should I need it.
exactly.
But yeah, it's I probably think about these things more than I should at
Doubt it.
times. But at the end of the day, it's a lot of conversations with my students really, and finding out like what they need, what they like, what they don't like. And a lot of people will tell me that that's pandering to them, and it's like, listen, I'm not completely changing my lectures for like they don't get to change the content. But if there's something that they really struggle with, then I feel like we owe it to them to at least ask them to figure out how we can make it better the next go around or the next semester when the topic comes up again, right? I mean, I just
Yeah.
don't know.
Yeah, that's I love that approach, Micah, because it's like, are we here to support them or are they here to give us purpose as teachers? Like, I need you all to sit here so I can justify my existence as a lecturer. Like, that doesn't even make sense. They're here to learn and we are supporting them and helping them through that process. So I think you're 100% right, to hear from them. Like, if there's something I could be doing better to help you in a better way, like, yes, I want to try to do that. Right. Like, no, you can ignore the naysayers. They're wrong about that.
So two things. I think this actually goes back to Bobby's comment about like assessment and how important it is to look at it a little bit differently than perhaps we traditionally have. And that's not just veterinary education. I mean, I think that's education writ large, right? K through whatever. But the second thing is that before we come to a close this evening, I want to give Micha an opportunity to talk to us about her forays into writing a textbook. So she mentioned textbooks, and so I wanted to give you a chance to kind of talk about that and how that came about, and how it's going, and just tell us a little bit about it.
It's going. Um, so yeah, again, I like to try and make things better. I like research. I like all the things. I'm a big nerd at heart. And I think one thing that my educational journey has shown me is how little information there is out there for veterinary educators to rely on. And it's getting better. The research body is growing. There's now 2 major texts on veterinary education. And where I still found a paucity was with clinical teaching. And to me, that seemed like a pretty big hole, especially given all of the changes happening with the distributive models, schools, and knowing that there are a lot of educators who are in an even crazier boat than I found myself. At least I made the decision to go in academia. I knew that was part of it. But now there are people sort of in, general practice or especially private practices who are signing up to teach, and that is not at all what they had bargained for on the outset. And so just trying to put some information and resources in one place where people who may find themselves teaching or wanting to sort of bring in house officers or students for preceptorships or whatever the case may be, have access to sort of summaries and reviews of the literature on like what might be some evidence-based ways to approach clinical teaching.
And I would say that would benefit not just the people who are newly finding themselves in this, but those that have been doing it for 15, 20, 30, 40 years and like actually just never learned any of this. So I think the potential audience to benefit from, a one stop for clinical teaching resources would be beneficial for lots of folks.
Yeah, agreed.
Yeah, that's the hope. It's meant to be all encompassing and very inclusive.
And I don't think that's limited to veterinary, educators, clinical educators. I mean, I think I argue a lot with people about there's a lot of things that are unique about veterinary education, but there are also a lot of things that are very similar across veterinary education, and that includes clinical teaching, right? We might be teaching for different species and different types of patients, but the essential core of what you're doing in a clinical medical situation is pretty much the same, right? It's all about problem solving, collecting the right data, sifting the data in a way that's appropriate, doing it in an appropriate time, knowing that when you press 2 + 2 into the calculator and it comes up with 5, that's not right, right? It's close, but it's not right, and being able to figure those things out. So I think there's going to be a really great audience for it. And when she first sent me, she's like, I have this idea for a textbook and I don't know. I'm like, oh yeah, that's totally going to get accepted. She's like, no. I'm like, no, it's a no-brainer. Like it's going to happen. And it went through so fast. And you were like, so now I have to write a textbook. I'm like, see, I told you. It's kind of like,
yeah, I went into this so naive. I can't even begin to explain. But, I'd also been, I sort of sampled the audience, Catherine being one of them. And, everyone's like, oh, well, you won't hear back from them for months.
yeah.
It was 3 weeks. And they were like, here's the contract. And I was like, oh, okay. So, yeah, this is a thing now.
Yeah, and then you're just like, what was I thinking saying I would do this?
Yeah.
Oh, that's awesome though. Yeah. It's
kind of
so
like that grant writing. Everybody thinks the grant writing is hard. It's like, yeah, it's hard, but then when you get the grant, then you actually have to do
that's the hard work. Yeah.
Yeah. It's when you have to do the thing.
So
yeah.
What is the timeline for the book?
Hopefully this summer.
Ooh. Yeah.
But we have had a couple of bumps in the road. So we'll see, but soon.
That's exciting. Well, it wouldn't be a textbook if you didn't have bumps in the road. So. Bobby, did
Yeah.
you have a Bobby, I thought you had a comment or a question.
No, I was just gonna ask. I was gonna ask for like where are things going, and then not like that's not enough, right? But like what like I would love to know kind of what the trajectory for you looks like. Like yeah, where you're kind of in the middle of things, right? And so where do you see yourself going in the future?
Um, Great question. The textbook, it's eaten up a lot of my time, but hopefully that'll be done soon. Next up, I was involved quite a bit with the League of Veta Humans, and so that's sort of delivering education to uh, kids, so K through third grade ish. And so we've been in talks. We got our grant approved or our sub award approved for Virginia, Maryland. So we'll be bringing a chapter there. And that will hopefully spin off into more like summer camps and more hands-on experiences for kids in pre-veterinary um, areas to sort of come and experience and hopefully get the next generation prepared. So,
That's
um,
phenomenal and so needed. So
Especially for the young kids.
well, because right, we're always
it's
talking
a
about
lot of fun.
we need more people and we need to, increase our not like we're opening a lot of new vet schools in the next several years, and like we're gonna need, good people to fill it. And I think our profession forever has missed out on huge swaths of people because we just haven't seemed accessible or people just aren't thinking about it. And so I love that. Because I think doing outreach at undergrad, while great, is too late in a lot of cases. Like we've got it. So I think that's awesome. I love that.
Cool. Eric, do you have any last questions or comments? Or are you still like, is your mind still blown by the?
No, yeah, no, I think I've got it settled. Like I'm not
Okay.
super all lost in the clouds anymore. But no, talking about future projects, that's what I was hoping you would ask. So that's great.
Okay, great. So I guess my last question for you, Micah, is sort of future projects are great, but where do you see you moving career-wise? Like, are you planning to stay in academia? Are you wanting to stay a clinical professor? Like, when you and I met, you were not necessarily clinical, and doing the things that you were trained clinically to do. And I know you missed that, and now you're in more of a clinical role, even though you get some teaching in. But we've also had conversations about potentially moving into administration, or kind of what are your thoughts around that, and what do you kind of hope will come your way?
I don't know. It changes every day. I'm going to be honest. Um, I the draw, a lot of the draw for me for academia, not only the education, but getting to sort of do a lot of highly varied things. And I think that kind of shows in some of the stuff that I've been involved with. And so I guess long term, if yeah, moving into administration where I can kind of put all these things together. So, um, academic affairs or student programming, something like that would be great. Um, and maybe that's in the 10-year plan, but I don't know. I don't know how to put a timeline on it, but I guess that the clock is ticking, right?
That fast. Cool. Yeah.
It's really awesome. Yeah, it's interesting. Like you start off in your career and you're just like, well, I'm going to be doing like this clinical stuff for forever, right? And then you kind of hit a point where you're like, I don't know if I can do this clinical stuff forever. Like is this this is kind of a lot. Can I see myself doing this when I'm 60? I don't know if I can. And then you're like, but what am I going to do? And then you do start thinking about what does that look like? And I'm with you, Micah. Like I love the variety that academia really does foster, and if it's going well, it celebrates. Like I want to do this and I want to do a little bit of that, and so that is really nice if you can find some type of position where you get to marry together all these different things that you love. So yeah, it's about like creating a position that's all the things you want almost.
Yeah. Any
Yeah.
last questions, comments? Do you have anything you want to bring up that we haven't talked about tonight?
No, I don't think so. I think we covered quite a bit of ground. But yeah, I hope that more people in the future, more veterinarians will look towards academia, because I think when I was in school, at least, going into academia was sort of like the golden, like that was, everybody wanted to be in academia because you were at the pinnacle, you were at the top. And I think we've suddenly seen a shift, and it's a little bit worrisome, because who are going to be the educators, and how will we get, there's all these schools opening and that's great, but how do we sustain this all and still afford some assurance that there's like the same level of quality? um and yeah, so
Yeah,
we'll
for sure.
see.
I mean, I think also though, it is a little terrifying to know there's that many schools on the horizon, and this is a whole nother topic, I'm sure. But I think one of the opportunities I see with so many schools is the opportunity to innovate from the ground up, which is with some of the things that we've talked about, just talking about, okay, well, how do we get more of the hands-on, truly clinical case experience into the classroom, maybe starting in that first semester where it's not this like, okay, here's a case, go at it. But it's like, okay, here's a case that we worked up. It may be just as it's an ear case, but how would you go about doing this and why? And then having them understand why it's so important to learn the language and learn the basics and learn the things in a way that is really meaningful. So it's definitely given me a lot of food for thought. It clearly gave Eric a lot of food for thought. So that was really fun. But thank you so much for joining us tonight. It's been great hearing your thoughts and your ideas. And I always love having a time to chat with you. So even if I have to share you with two other people, I'm happy.
Yeah, thank
Thanks
you.
for
Thank you
sharing.
so much.
Really
It was
appreciate
Yeah, thanks for
great having
inviting
you.
me. This was fun.
Awesome. Thanks so much, Micah.